Hello friends, today we are going to discuss about psychotherapy documentation. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. In this video, I'll be discussing about psychotherapy documentation. That is, what are the records which needs to be kept when psychotherapy sessions are recorded. At the same time, I'll be discussing about different documentation approach for psychotherapy. First and the foremost, all mental health professionals who are involved in psychotherapy should be familiar with the legal and ethical framework required for record keeping in specific professional context and jurisdiction. In this definition, you need to understand and appreciate professional context. That is, if a psychiatrist is involved in psychotherapy, you need to fulfill the obligation of the respective professional field. It may be medical counsel or else psychiatry body. Similarly, the psychologist need to follow their professional body at the same time if there is a legal requirement. Hence, the requirement is as per the profession at the same time in the area of the jurisdiction where you are practicing psychotherapy. Record keeping and documentation is essential in planning and implementation of any appropriate course of psychotherapy services. This helps the psychotherapist to monitor the improvement and outcome of the client. If you look at the documentation of psychotherapy, at least 9 different categories can be divided in documentation or record keeping. Invariably, in the classical textbook, they mention about only 3 types. One is intake session, the other one is psychological assessment and progress report. Another one is a psychotherapy notes or process notes. However, I would like to classify into 9 different types of documentations or records which are classified in psychotherapy. First one is referral letter, intake notes, consent form, detailed evaluation, psychological assessments or structured assessment, session notes also called as progress notes or case notes, psychotherapy notes also called as process notes, referral, termination or dropout of the patient and their respective notes, and finally formulation and summary notes. These are the 9 different types of records or documents which are required for a complete psychotherapy. Let's look into each one of them. The first one is referral letter. As you know, if you are a psychotherapist, invariably you may recruit the client directly or else you may get the client referred from psychiatrist, any other mental health professionals. It may be from legal agencies such as court, family court, maybe juvenile board, child welfare committee, schools, commissions like child commission, women commission, and other statute bodies like National Human Rights Commission, schools, colleges, and of course self-referral. Whenever such referral comes, please do document that and take a copy of the referral letter for your future reference. At the same time, you should know what is your role and responsibility when such referral letters are accompanied by the client. Now moving to the second, very important is intake notes. Intake session is the first session between the client and the psychotherapist. Here, along with the client, family members or his friends may accompany. In this first session, the client will talk about his background, brief chief complaints, the reason for referral. At the same time, the psychotherapist will briefly assess whether there is any acute crisis, suicidal ideas, homicidal ideas, any legal requirement, and whether the psychotherapist has the capability for providing the services which the client is seeking for. During this period, he will also explain the roles and responsibilities of the client. At the same time, he will also report what are his responsibilities and role. At the same time, discussion about the session, time, mode, hybrid or online, frequency, cancellation, contact number, those will be discussed. And finally, the payment, confidentiality, and limitation of confidentiality will be discussed between the therapist and the client. Please remember, the first session is very important. The reason being is, this is the foundation session for the long-term relationship between the client and the therapist. Moving to the third, consent form. Here in the consent form, there are various different types depending upon the type of therapy. One of the important thing is, if the individual therapy is done, it is between the adult client and the therapist, the consent form is very easy. Imagine if the client is a child, the consent should be taken from the guardians or the parents. If the child is adolescent, I would request you to take assent form also. If it is a family therapy and group therapy, you need to take consent from each one of them. At the consent form, please discuss about the confidentiality and also limitation, which are clearly written in the form, and also how to access basic medical records. Suppose if you are documenting, if you are doing audio recording, video recording, how the records will be kept, how long it will be kept, who can access, who cannot access, limitation of confidentiality, the role of courts, and at the same time, if there is any legal issues, how the records will be provided to the legal authorities, and if there is any amendments in psychotherapy. For example, if the patient is undergoing cognitive behavioral therapy and you realize the patient has severe anxiety symptoms, you would like to switch over to behavioral therapy or JPMR or maybe yoga sessions. In such a scenario, the type of psychotherapy has been amended. During that time, you have to take a new consent. What is the payment? How the payment will be made? If there is no show or cancellation, whether it will be charged or not? What is the contact number? Emergency contact policy and numbers will be discussed in person during the first session. At the same time, consent form will be given and the signature will be taken. A copy of the consent form has to be given to the client also. Although it is not mandatory, it is a good practice to give a copy of the consent form to the client. Moving to the fourth, detailed evaluation. Although many of the psychotherapists do not do detailed evaluation, and they do this detailed evaluation as and when required in a patchy manner, I would request most of the psychotherapists to do a detailed evaluation in 1 or 2 sessions. It starts with demographic details, chief complaints, history of presenting illness, past history, family history, personal history, premorbid personality, mental status examination, cognitive function, diagnosis, and of course, you will have formulation. The formulation can be clinical one, and if you are planning a psychotherapy, psychotherapeutic formulation also play a crucial role. Moving to the fifth, can we do or does the patient requires any psychological assessment or any structured assessment? Suppose after doing detailed evaluation, you need to quantify the severity, or else you want to do some projective tests. Then during this stage, it should be attempted. You need to clarify certain symptoms. You can administer certain scales. It may be Weibox scales, Ing Mania rating scale, Beck's depression inventory scale, ADHD scales, PANASS, anxiety scales, SLD assessment, and autism rating scale can be used. Similarly, various psychological assessment from IQ assessment, family assessment parallelly can be done by somebody else, reality testing, projective testing, personality assessment. These are the assessment which can be done. However, the main therapist can do himself, or else he can refer this to a psychologist or a different psychologist who is good in certain assessments. The assessments need not be done by the same therapist who is providing to do psychotherapy. And here you need to know what are the legal requirements for keeping the assessment notes. Psychological assessment notes as per Section 25 of Mental Health Care Act of 2017 talks about basic medical record. These records have been prescribed under the Mental Health Care Rules 2018 Form B. This mental health care rules is rights of persons with mental illness. This is how the Form B looks. In this, you need to document the psychological assessments, and if you are the supervisor, you are going to sign, or else if it is assessed by your subordinate, both of you need to sign. You have to verify and also document it and keep it as a part of psychotherapy documentation. Moving to the important sixth, that is session notes, also called as progress notes or case notes. Progress notes are part of the medical record. Here, all these session notes or progress notes are kept with the medical file. Here, this progress notes or session notes includes patient data, time, session duration, number of people involved in the session, whether it is an individual session, joint session, behavior, feeling, legal issues, clinical state of the patient, progression, or whether he is improving, not improving, whether the patient is doing achievements, in micro gains are occurring, course of the therapy, either inpatient or outpatient, will be documented. Therapists are generally required to generate at least one progress notes for each session. That means for every session, you need to generate one progress notes. Progress notes is to document the reasonable work that occurred towards the goal of helping the client. It helps in keeping the track of significant achievements or deterioration of the client during the therapy. At the same time, the clinical status of the patient will be documented here. And please remember, this progress note or session notes are part of the medical record, and they can be accessed through RTI or through Mental Health Care Act of 2017 Section 25 talks about right to basic medical record. Let's understand what are this recording of session or case or progress notes. Here there are different format. First and the foremost is SOAP format. What is this SOAP? The SOAP is a mnemonic. S stands for subjective, O stands for objective, A for assessment, and P for plan. Here the subjective of the patient's behavior, thoughts, emotion, perception, and sensations will be discussed by the client. Objective, where the therapist is going to observe them and his observations will be documented. Assessment of the practitioner or the psychotherapist with regard to patient's improvement, interpretation, defense mechanisms, various other notes will be documented. The plan will be homework assignment. At the same time, what are the actions to be taken? SOAP is usually used in the medical institutions. Second one is BURP format. Again, it is a mnemonic. B stands for behavior, I stands for intervention, R stands for response, P for plan. Behavior, as it is noted by both the client and also the therapist, will be documented. Regarding the intervention, what type of intervention is chosen by the psychotherapist for the particular behavior, feeling, sensation, or interpretation. What is the response of the client? At the same time, the response of the psychotherapist with regard to patient's intervention will be documented. And finally, the plan. We are outlining the plan for the next session, and homework assignment will be given. Moving to the DAP format. DAP format is data, assessment, and plan. Here, the data is again with regard to behaviors noticed, feelings of the client, and also with regard to cognitions, that is thinking of the client. All these are considered as a data which are subjective of the patients or the client. At the same time, the therapist interpretation of all these things will be considered as data. Assessments are therapist describes their interpretation of the patient's data will be considered here. And finally, the plan. It is here you are going to do homework assignment and planning for the future sessions. And finally, the DART format. D stands for description, assessment, response, and treatment. Description of the behavior, thoughts, emotions are the description which can be subjective, and also the objective description of the client's behavior, emotions, and thoughts. Assessments are the interpretation of the therapist, and even the client can be considered. Response of the client to the patient's whatever the intervention is asked. At the same time, what is the response of the therapist? Finally, the treatment can be the modification of the behavior, thoughts, and the cognition is considered here. However, what is the legal requirement for the session notes? What does Section 25 of Mental Health Care Act of 2017 reports of? The basic medical records format is given in the Form B of Mental Health Care Rules 2018. This rules also is considered as Rights of Persons with Mental Illness Rules. This is the session format. The session format has various different parts, and I'll be discussing separately with regard to assessment format and also session notes in a separate document or a video, which will be part 3. Please visit my YouTube channel for part 3 video. Going to psychotherapy notes. Here, psychotherapy notes is different from session notes. Psychotherapy notes means this is notes recorded by the psychotherapist, that is the health provider, with regard to clients. What is the hypothesis the therapist has made? What is the analysis he has made? Any important information which the therapist want to discuss with the supervisors will be made here. Here again, these are all unwanted notes which are not understood or cannot be understood by the legal authorities or maybe by the patient. These psychotherapy notes can be just scribbling, flowcharts, diagrams, or else pictorial diagrams which can be utilized to understand the patient's psychotherapy process. It is basically what the psychotherapist thinks about the patient. It is not in the format of medical record. And these psychotherapy notes are not part of the medical record. It is protected under the law in certain countries, and it is usually maintained separately from the medical record. Psychotherapy notes need to be kept confidential, secured, and it contains sensitive information, and these psychotherapy notes may not have any identifiable demographic details. It is the notes which the therapist wants to keep it for future referral or else for the discussion with the supervisor. Please remember this. It can be anything. It can be diagram, it can be scribbling, it can be flowchart, even the paper cuttings. Here, psychotherapy notes do not contain any personal information of the patient, data, legal issues, or progressive notes are contained here. Psychotherapy notes can be part of the medical record in certain countries, or else it can be kept away from the medical record, such as in US or in a hybrid method. At present in India, there is no distinction between psychotherapy notes or session notes. Invariably, in India, psychotherapy notes is a part of medical record. It can be accessed through Right to Information Act. That means the patient has a right to access those notes also. Although in UK or in US, psychotherapy notes is kept separately from the medical record. Although the judicial process or the court can ask these notes. Moving to the important part is the referral, termination, and dropout. As you know, in psychotherapy, during the session, the client may drop out. If the client do not report back to you over a period of maybe 1 or 2 months, as per the policy of your institution, or else your individual practitioner, you can close the notes telling that the patient did not come for therapy and the dropout notes can be written. At the same time, if there is a termination or weaning of sessions, that need to be documented. And if you are referring to somebody else, or if the patient is moving from one place to another place and you are referred to another psychotherapist, those referral notes and referral letter should be documented. And these are very important documents which need to be kept. Moving to the final, that is formulation and summary notes. Once the patient completes psychotherapy successfully, you need to give the summary or the formulation so that the patient has the clean record how many therapy sessions he has undergone, what are the hypotheses which were planned, and how much the patient improved, how many booster sessions were taken, what are the recommendations, rehabilitation plans, and those needs to be documented and copy should be given to the client. To conclude, my dear friends, psychotherapy notes are very sensitive. They are very sensitive records. Confidentiality of the records are very important and they are bound under the various legal statute depending upon the jurisdiction, country, and the profession. Psychotherapists are responsible for documenting, recording, storing, retrieving, and disposing of these materials. It can be in the format of pen, paper, audio, video, or combination of above. And in India, Mental Health Care Act of 2017, under that Mental Health Care Rules of 2018, Form B dictates the psychological assessment format and session reporting format. In India, the psychotherapeutic notes, with regard to that, the statute is silent. But please remember, persons with mental illness have right to basic medical records as per the legislation. You need to remember this. Thank you very much for your valuable time. Stay safe.